Hello again, everybody. Thank you again for joining us for our podcast today. We have quite a few questions to go over, some related to workplace salary, different expectations, and all of that. So, Dr. Ang and I are going to go ahead and talk about all of those things with you. But to start us off, Dr. Ang, what tea are you drinking today?
I'm just having a regular green tea, or I guess you would call it sencha. What about you?
Sancha, that sounds good. Right now, I have a black Assam tea mixed with a little bit of milk and a little bit of honey. I'm a fan of mixing everything in my
Yeah,
tea.
we're gonna have to post some of your recipes just because it looks great, and I haven't really tried all these different combinations before.
Oh my gosh, we should definitely add that. Okay, so our first question of the day, question number one. What wage should we negotiate for when offered the initial pay rate? How much more than what they're offering, and what should we expect to make in the first year?
Yeah, this is a tough question to answer, and I say that because it is going to be very much region specific. So I'm not gonna try to give you the cop out, it depends answer, but where it is a lot more dependent is your region. So obviously somebody who might be working in the state of California is gonna make a much different salary versus somebody who might be in the Midwest or East Coast or even in places like Alaska or Hawaii. We'll talk about some of these examples when we go through some of these job postings. I think predominantly our audience is from the Southern California area, so we'll pull up a few of these postings in LA. And you're also going to see that quite a few of these are different depending on your setting. So it's not just your city, it's not just your region, but it does depend on if you are working in pediatrics or in hand therapy or in outpatient adults, mental health, etc. So a lot of different factors to play around with. But before we start crunching the numbers, Riza, let me ask you first, because I see this a lot. I see sometimes where a student enters the OT program. Halfway through the program, they realize how much or how little, I guess, an OT might make, and they drop out. Like they decide that, wait a second, I'm spending all this time here in this OT program when I should have gone into something like nursing or PA, and then they leave. Which sort of boggles my mind because you sort of sign up for this program, you take out a bunch of student loan debt, and then you realize that it might not be for you based on the salary. But what were your expectations when you were looking into OT?
Yeah, you know what? Ironically enough, I knew that it would for sure get me out of where my family currently is, right? But I never really thought about how much the pay was. I just knew OT was something that I was really passionate about and I felt I really wanted to be part of. But I did my research prior to applying for the program, and I did see somewhere in between like the 80 to 90 to 100. Those are just some of the numbers that I saw, and I figured it would be different for, I mean, I live in Southern California, so I kind of expected that range, but I definitely can see it varying maybe in different states, like what you mentioned. But yeah, so those are just some of my initial, I guess, the numbers that came up for me.
Got it. Yeah. And I think even for myself, and this was over 15 years ago now, when I was doing my own research back then, I thought I was going to go into pediatrics. So I looked online on websites that are very transparent, like the Los Angeles Unified School District. They will have their pay scale there for OTs and PTs and other school districts as well. And those were not like huge ranges that you're probably going to see today, like on Indeed.com or wherever else that you might look for jobs where you're getting such a big range. These are pay scales that are, approved by the city, approved by the state, and they're pretty transparent. It has nothing to do with how much merit you have. It has to do with like your years of experience. So what I saw back then was in the mid 80s. 15 years ago, and that was a salary that I thought was feasible for me, which is why I continued on with OT. So for those pursuing occupational therapy, if you're thinking of getting into this because you're going to be making like well over 150K a year, etc., I think it would be smart to temper some of those expectations. Because that's probably not feasible unless you have multiple jobs. You have like a full time, you have a side hustle, or you probably have a couple of part times, or maybe you're a small business owner, or you're doing private practice. All right. So in this first slide, we see a couple of pediatric opportunities here for pediatric outpatient. We see starting at around 79K a year. For school based, we see about 89K a year. And again, it's going to depend on your city because even in Los Angeles County or in Southern California, you're going to see a big discrepancy between LA County and Orange County and San Diego and San Bernardino and wherever else, Oxnard, Ventura, etc. So all of those things to keep in mind. I think the best way to go about this is really be in communication with your colleagues, your friends, people in your program. Quick story that I want to share is my cohort when we first started getting passing the board exam and getting licensed, etc. My friend group, we were all in communication with each other in terms of what offerings we were getting in terms of jobs and benefits, etc. We all decided in our friend group, there was about 28 of us, that we would not accept anything lower than about $40 an hour, which equates to about 82, 83K a year. So when we saw that, some of us were being offered in the mid 30s, we weren't taking that position. We were waiting until that it was at least 40 an hour. And I think even now today, if you were to do that with your own friend group, you can, not saying that you create a union for yourself, but you can hold out for some of these higher salaries. So with school based, we can see that we are sort of in that 80 to 90K range. I'm assuming that this is probably at the starting position. If this is something that you want to negotiate, I think it might be a little bit tricky because, as I mentioned, some of these school based salaries are going to be paid on a pay scale. Doesn't really matter what your degree is. Doesn't really matter like how many A's you got in your program or how wonderful you are. If you are a year one entry level OT, this is where you're at. And then at year two, this is where you're at. Year three, this is where you're at, so on and so forth. And it can grow pretty fast. But it grows accordingly. So I think that's sort of something that you have to talk about during the interview process. Is your pay going to increase based on your merit, or if it's going to increase based on your years of experience, and how do they calculate all of those different things? Cool. So in this next slide, we're going to see a big jump in salary, at least here in Los Angeles. So if you're in home health, they put a range there of 104K to 135K a year, skilled nursing 109. Well, first of all, let me talk about why there is such a big range in salary. And you didn't really start seeing this until they made it law in certain states that job postings need to have a salary. And of course, for employers, they weren't really on board with that. They weren't really happy about that. So they've just ended up putting a really ridiculous range of a very low starting and a very high starting. And it basically just told everybody out there that, this information isn't going to be very accurate. So it's going to be very dependent on how you interview and like what the benefits are, etc. So this whole point of putting the salary range really just shot everybody in the foot because it gave such a ridiculous range that nothing is really accurate. That's not true for everything, but for a lot of things out there, especially for the really big ranges, that's what you're going to see. There's a big difference between 104 and 135. That's another part-time job. But that's just FYI. So in home health, you have to be careful about this one because a lot of home health opportunities out there are going to be as somebody who is going to be hired as an independent contractor. So you may not be a full-time employee. You may not have the benefits. You may not be a W-2 where you're getting all these, 401ks, etc., vacation time, paid time off, so on and so forth. You're basically an independent contractor where you're filing your own taxes, you're being paid as a 1099. Like all of the equipment is going to be up to you to purchase, your documentation, etc., is going to be up to you to sort of upload using your own systems, perhaps. So the expectation is that you are going to be paid higher, but some of your overhead costs is going to be significantly more as well. So just something to think about there. Skilled nursing facility tends to be on the higher end of the range. So as you can see here, about 109K. And I want to say that that's pretty average here in Los Angeles area, especially because in skilled nursing, you know that the PTs and OTs are the ones that tend to get the higher amounts of reimbursement. They're the ones who's making the facility more money, and as a result, they tend to be more compensated. However, the drawback there is your productivity expectation might be really, really high, obnoxiously high, possibly unethically high, even bordering illegally high. So just some of those things to really think about, because if they're expecting you to have a over 100% productivity, or if they're expecting you to see more than one patient at a time and you're billing it not as group therapy but as individual therapy, those are some red flags. So with a higher salary can come other risks that you just need to be mindful of. And we'll probably have a future conversation about the ethics and the legality of some of these things. Okay, so in outpatient hands, 114K roughly. And I would actually like to see if this requires a certified hand therapy certification. Riza, we'll talk about certifications a little bit later on. But with some of these things, you really have to do a deep dive into what they are requiring. We talked a little bit earlier about degree doesn't matter if you're having an MSOT versus an OTD. Maybe not, but in certain cases, they might require you to have different certifications. So in this case, maybe being a certified hand therapist, or at least in California, an HTC, meaning that your hand therapy is certified, not quite the same thing, but you are allowed to do things a little bit more independently. Travel OT, looks like it's about 112K a year. So travel OT tends to pay a little bit higher because there are some things here that they don't necessarily have to pay for. You're not going to be, in a lot of cases, a full-time employee with them. You're probably going to be contracted out for a couple months at a time. Some of this, they will give you a stipend, like a living stipend, or they'll give you some money for mileage and gas, etc. So it really depends on how you work out the contract. So at 112K, I might be asking things like, does this include, living costs? Does this include benefits? Does this include anything else? So even if they put a very high salary there, you have to look at all of the other sort of benefits.
So a lot of things to consider there.
For sure. So our last slide, we see a bunch of different outpatient settings. The average of this is roughly around 80K. Again, you're going to see wide ranges, but at least in California, 80 to 90K is usually the starting salary. This inpatient rehab, whether you're working with the geriatric community or pediatric community, this tends to be sort of the range that I see. Unfortunately, this is a range that it was 15 years ago. You would assume or hope that it would be higher, but a lot of this is going to be based on, reimbursement rates, et cetera, which for OTs, I wish we were better at advocating for ourselves, but we don't really see such a huge jump in increase because Medicare. So going back to this question, is the salary negotiable? How much should we negotiate? Well, first things first, I think anything is negotiable. I think if you try to negotiate, it shouldn't really detract from you being a good candidate whatsoever. I think it's the expectation is that most people will be willing to negotiate. How much, that's the trickier question. I think this is where you need to know some of your numbers, you need to do your research. If you're going to say something like, I don't know, a job is offering a starting position of between 80 to 90K, and you wanted to ask for like 110 or 120, like you're going like that much higher, they might wonder like where you got that number from. And I think a trick that a lot of us tend to play is like, oh, I got offered another position at this amount or that amount. That's a good trick, but it needs to be within reason. So for example, let's say you're applying for an 80K job and you're saying that I'm being offered 100K at another position. Well, as the manager, I would say something along the lines of, well, unfortunately, that's probably something that we can't do just because of our reimbursement rates. Because at 100% or at 100K, it would probably put us in the red in terms of actually, paying you and seeing our patients and the overhead costs, et cetera. So that probably wouldn't be feasible. So I would say a 5 to 10K range per year is something that you can probably suggest. I wouldn't be surprised if they rejected the 10K, they gave you somewhere closer to the 2 to 5K range, which can absolutely be a big deal, especially if you're an entry level therapist. but I definitely wouldn't expect anything in the 15 to 20 range unless like your initial offering was in the 60s, which I would even be suspicious of taking a job at that price point.
Got it. So I have a follow-up question with something that goes along with all of that is if you were to have, let's say, certifications in some points, and you came into this interview and you said, I have so and so, how does the employer look at that candidate? And how do you think you can use that to argue for your pay raise?
Again, I hate to give the it depends answer, but what we've been finding, especially when we've been doing our own surveys and research, et cetera, is that it does depend on what the facility wants and what they need. Like when it comes to money, or I guess if you really want to break it down bare bones, like economics, it's really all about supply and demand. You
Mm.
know, if you have somebody who's coming in, especially in California, where we have all these advanced practice requirements, like if somebody is coming in who has a PAM certification, an HTC certification, swallowing, etc., if you're going to just some random hospital or facility and they don't see any of those patients, they might not care. They're like, okay, well, you have all these certifications, but that's not our caseload. You know, that's not our audience. So it might benefit someone else, but doesn't really benefit us. So they might not compensate you for that. Versus if you were in a facility and it's a they do a lot of surgeries for hand therapy. They have a lot of patients that they see for dysphagia or pain. Then yes, a swallowing certification, a physical agent certification, might be beneficial. What we've seen from my other hat as the executive director at the Neurospecialist Institute with our certification CNS, about 7, 8 years ago, not a lot of facilities cared about that. It's more recently now where all of these facilities are becoming stroke centers, or they're becoming a little bit more versed in neuro rehabilitation. They're starting to realize that not all neuro rehab skills are created equally. They're now looking for people with certifications such as CNS. And we've heard this directly from hospitals. We've heard this directly from directors that they're looking for those with a certification, not necessarily CNS, although like that's what we've been researching. Anything that really shows that the person is going above and beyond like their general OT license or PT license, that they're really taking the time to add to their skill set.
Yeah, and I think this really applies to students as well. With the CNP course that the Neurospecialist Institute offers, I know that some fieldwork sites had actually asked, like, oh, the CNP, like, can you elaborate? And it actually looks really good for students going into different fieldwork settings in neuro or even in hands. Sometimes they look for different, like, hats that the student can put on.
Yeah, that being said, I think and what we found more so is that with the CNP certification is for those, because this is a certification for students, as you're applying for your first job as an entry-level candidate, that was something that a lot of sites saw that was beneficial. Like at the student level, you have now become certified in something related to neuro. And CNP is not the only one that's available to students. You can get certifications in other types of modalities. You can get certifications in something like kinesiotaping, et cetera. So all of those things that you can add to your name can certainly be helpful. That's not to say that, they're going to make you or break you, because as I always tend to mention, your name is the most important, like who you are as a person, as a therapist, how you interview, et cetera. That's going to be the most important part of this. But a lot of these things can certainly boost your resume, or they can certainly set you apart if you're competing against other candidates, especially if there are dozens or hundreds of candidates that are vying for the same
Yeah.
opportunity.
I mean, if students have a leg up on, on their learning, then I think that's always going to benefit them in the long run. Okay, and then moving on to our second question. What are the best places to work if you want the most time off, insurance benefits, 401(k), etc.? I think this is a really good question because I also wonder this.
Yeah, like when I first saw this question, I wanted to say something big like Apple or Google, like that's when you hear about like the ones who get all these benefits and they get stock options, like you want stock options at Google or Apple, their cafeteria, the free food, etc.
Yeah.
So that being said, like what does it look like for us? And in a lot of cases, the bigger the facility, the bigger the sort of organization, you're probably going to get more. Just because you're sharing that bigger pool, they're no longer what we would call a small business. They're not limited to the amount of employees. They're these giant corporations, such as a Kaiser or, a university hospital, I would say would probably give you the biggest benefit package. All that being said, if you happen to work at a smaller facility, they can also be competitive. They can be competitive in other things. They can be more competitive when it comes to pay. They can be more competitive when it comes to job opportunities and growth. So if you imagine you might work in this really, really large organization, you're going to be an occupational therapist or a physical therapist, and you're going to be an OT level one, two, or three, or wherever you're at. You might not see growth there in terms of being a supervisor or a manager, and you might have that opportunity at maybe a smaller facility. So just some things to keep in mind. All that being said, when it comes to like your benefits, your 401k insurances, pay time off, etc., at some point they all start, you might not see major discrepancies. Like when it comes to pay time off, like you're not really going to see one place that will give you like 5 PTO days versus someone else who's going to give you 50. Like the range is pretty much going to be like 15 to 20 days per year, something along the lines, like nothing that's going to be double or triple. I would say that probably the biggest thing is maybe your 401k, because some places will not match. Some places will match only 1 or 2%, and then some places will match 5%. Now, in the grand scheme of things, that actually makes a really big difference. If you find a place that can match 5% over the course of 20, 30 years, and that can actually be a lot of money on the table. So that's probably something that I would prioritize first is the 401k match.
Okay. All right. Thank you so much for that insight, Dr. Hang. I never would have thought to prioritize a 401k, but I think that's something that I would definitely look for while I'm interviewing and even applying for certain positions. All right. So number three, what are some red flags we should look out for during the interview?
Well, two things always come to mind. The first one, and this is information that might be tough to get in the interview, but you can sort of get a feel for it. It helps to know somebody who might work there, or it helps to actually have a chance to talk to somebody who might work there. So you're not just talking to the director, the supervisor, or HR, or whoever's interviewing you. If you have a chance to actually speak with some of the employees to give you a behind the scenes insight, then that would be most helpful. And the two things that I would be most concerned about is if there's number one, a high turnover rate, and number two, a high productivity standard. So with high turnover, if you're seeing that a lot of therapists are rotating out of this job, they're quitting every 3 months, they keep replacing this position every couple of months, that there might be some kind of issue, whether it's a monetary issue, whether it's an ethical issue, whatever it is. But for whatever reason, somebody like who's leaving, or people who tend to be leaving all the time, that's a big red flag. The second thing, as I mentioned a little bit earlier, is if you have a high productivity standard. So if you have something insanely crazy, like we have 100% productivity or even 95% productivity, where you don't, at least in California, you don't get the two 15-minute breaks that you're entitled to. You don't get the 30-minute lunch break that you are obligated to get. You're documenting throughout all that time, or you're expected to do patient care during that time, all of those things bordering on the line of illegal, unethical, etc. So those are some things that I would be on the lookout for. What about you, Riza? I mean, like if you hypothetically, if you were interviewing with a place, what would be a red flag for you, or what would make you feel uncomfortable working there?
I want to say upon arrival, if I can get the general vibe of the clinic or whatever setting that I'm in, if I see there are patients that are waiting for a long time while I'm waiting for my interview, or if I notice that there's no consistent back and forth in the emails, or if there is the way my name is misspelled in the email. Like I would think about those things, those really small details, just to kind of see like how would they view me as an employee and how would they treat me if I was to be working there as well. So those are just some the really small nuanced things that I feel like I would pay attention to. But as far as red flags go, like some of the questions that the interviewer is asking, just pay attention to if it's relevant for the job. There are some questions that interviewers might ask that might be a little more personal and not related to the job. So as a newer grad transitioning into the professional field, just know that you're also there to interview the setting because you yourself are trying to find a good fit for you. So I guess those are some things that I would kind of recommend.
Yeah, well, I'm glad that you mentioned all of that. Two things I want to say. The first is, some of those minor details that you're talking about, they're not so minor. It goes to show like how much a place is organized or disorganized. So if they, can't get your name right, or if they mess up on timing in terms of scheduling, etc., or just like these little things here and there that shows that maybe they're not the most professional or organized place to work in, I would be concerned about that because that's something that you're gonna have to put up with during your career there. The second thing in terms of like interview questions that might be a little bit more personal or inappropriate, I would say yes, absolutely. Those are red flags. You want to be careful about places, and not saying that they're going to discriminate against anybody, but if there are things like, if they're asking like, are you planning to get pregnant anytime soon? Or are you, with your family life, how are you able to balance your work life, etc.? Those are things that they probably shouldn't be asking. I think a lot of professional organizations are really careful about some of the interview questions that they should ask a person. So if some of these questions come across as personal, or inappropriate, I would maybe be worried about that. Because the ones that are really professionally run, they're always afraid of liability. Like they wouldn't ask you anything related to, your maybe your family life or how many children or like your pregnancy or potential pregnancy, etc., because they don't want to get in trouble in terms of hiring or not hiring somebody based on their availability. They don't want to be accused of potential discrimination. And the ones that are really on top of these things and they have a good HR system, they will let the interviewer know, like the director, the supervisor, that these questions are off limits. We don't care about them. Don't ask them, etc. So, and you can tell that those are ones that are really organized. Everything is pretty much streamlined.
Totally. So just to piggyback off of the organization thing, there was also another story that I heard where someone had an interview, but in a car. Also pay attention to the room and the area that you are being interviewed in. And that can kind of play into part of like the organization and the professionalism of the place that you are interviewing for. Because I don't think I can imagine interviewing in a car.
That's really interesting. So who was in the car? Was it the interviewee or was the interviewer like in a car and the interviewee was,
It was the interviewer and then the interviewee. So they had met in front of the building and said, "Hey, come to my car. We'll just have the interview there." And then from there they said, "Okay, great. We can have you try working for a few hours at the site and I can drive you." And so from there that's like one of the red flags. Like it almost seems like a scammer.
Wow, I think that's a big liability issue because imagine if something happened in that car ride, like number one, that would be a disaster. The only time I think that would be appropriate is if you were interviewing to be a car salesman, and like maybe they're trying to show you that this is what they do,
Yeah.
during a drive around. But wow,
Yeah, this was specifically for from someone I heard applying for an HR position. So that's why I thought,
okay,
are you sure?
yeah, maybe not what not to do.
Exactly. So major red flag there. All right, and question four, how likely are you to get hired at your fieldwork site?
I think this goes back to supply and demand. Once again, if there's opportunities available, I think that you are a pretty good candidate, especially if you've made a really good impression on them during your fieldwork. And again, that's if there's positions available. But there are some fieldwork sites that take on a bunch of students. They have a bunch of therapists. It's like this big big, huge machine and they're really efficient and they don't really have anything necessarily available, it might be a little bit tricky to get into. So, all that to say, fieldwork, great opportunity to make connections, get your foot in the door. If they have something that's available, whether it's full time or even per diem, where you can be, a per diem therapist and at some point possibly be full time. I think all of that helps your case, especially if you know everybody and they've worked with you. But the likelihood of getting into your fieldwork site really depends on how many openings are actually available there. Do you have any thoughts on that?
One of the things that I heard previously was that if they have someone who's already pretty well rounded in the clinic that they're in and they're aware of the workplace culture, they're likely to hire on someone that everybody in that clinic is comfortable with and someone who's already familiar with the protocols in that specific site. So I think that's also one of the things to consider if you can, like what you said, Dr. Ang, like getting your foot in the door and making sure you kind of are in tune with the workplace culture, because that's super important as well.
Yeah. That being said, I mean, and we can flip this question around too for OTD students and their capstone, et cetera. So Riza, you're doing your capstone with us at the Neurospecialist Institute, and we've had a number of former OTD students, now alumni, who did theirs as well. And we're always pulling the our former capstone students back into the mix, whether they can be an independent contractor, whether they can be per diem, in whatever opportunity we have. And we're not really pulling what we call an outsider in because they're not familiar with what we do and like how the mechanics works in terms of how we run events, etc. So I think as we mentioned already, knowing like sort of the system, you're going to be the more ideal candidate.
Well, thank you. So, question number 5. How soon after getting hired can I ask for a vacation time?
So this one's interesting because this has two different dynamics, right? Like the first is whether or not you have PTO or pay time off, or the second is like you just don't have any of that accrued, which you probably wouldn't right after you first got hired and you're just looking for time off to go somewhere or do something. So if you do have a vacation plan prior to getting hired somewhere, I would just say during the interview process, hey, during this time, during Christmas or Thanksgiving or whenever it is, like I did have this plan to be away for 1 or 2 weeks. If you let them know prior to all of the onboarding and orientation, etc., I'm sure they will accommodate you. Like we understand that you are a person, you're human beings, you have other obligations, etc. So I'm sure they will make accommodations for that if you let them know beforehand. If you're expecting to get hired on and start collecting PTO right away and then wanting to take vacation time, it's probably going to take you a while because the accrual of hours would probably take a little bit before you actually get a whole day off or like a whole week off. Like it's going to be at least a couple of months before that actually happens. So if you're looking just for time off, I'm sure you can make arrangements with your supervisor and you can get that whenever possible. But if you're looking for paid time off, that's the difference there, right? Regular time off versus paid time off. Paid time off, it's probably going to need to be accrued over some time.
Got it. So, when in doubt, just full transparency is probably the best way to go.
I think so. And I think at any time, like if I wanted to take time off right now and I have a bunch of pay time off, like I'm not just going to say, okay, well, I'm going to go on vacation and leave everybody hanging. I want to, or I should, the professional thing to do is to be transparent with your supervisor, let them know what you plan to do as soon as you know, so that they can make accommodations, they can fill your role, they can fill your spot because they don't want to lose the caseload, they don't want to lose patients. Yeah, especially if you're working in our field as occupational therapists, where we, as again, like we are the teddy bear profession. We care about our patients. We want to see them do well. We don't want them to have any relapse in their recovery. I think full transparency is really needed. It might not be required, but I think it could be so helpful for your organization. It could be so helpful for your patients. Let them know when you're planning to take time off so that they can make accommodations, fill your spot with somebody else, get a per diem therapist in there, get a registry therapist in there so that the patient doesn't lose out on their plan of care. They can continue on with therapy. You don't lose anybody in your patient caseload. So when you come back, it's an easy transition to come back. You don't necessarily have to make it a very big or stressful thing.
Those are some communication skills that I feel like a lot of new grads need to take into mind when they're going in and requesting for that time off.
I think if you are aligned with your workplace, in terms of culture, and you feel like your supervisor is approachable, then you can be honest and open with them. I think they'd appreciate that.
Yeah. Thank you everybody for tuning in. We do have an email here available for you guys. So if you have any other questions that you want answered or talked about, feel free to send an email to us with all of the questions and maybe some insight that you might want to share as well. Alrighty, thank you so much.
Thank you.